Overdoses involving methamphetamine are increasing here in Oregon. Jillian Fortner looks at how local numbers compare to the rest of the state.
From 2009 to 2022, the number of people dying from meth overdoses increased more than 20 times, according to the Oregon Health Authority. 58% of the deaths involved other substances, including fentanyl.
It really does increase the risk of overdose by using both stimulants and opioids.
Deschutes County Health reports overdose numbers are lower here than in the rest of the state. In Central Oregon, less than 1% of emergency room visits in the last 3 months were related to opioids or stimulants.
I do know that even though Deschutes County continues to have one of the lowest drug overdose mortality rates in Oregon, it's important to remain vigilant. We're actively working to prevent any deaths.
Opioid overdoses can be reversed by the life-saving medication Narcan, but the same can't be said of methamphetamine.
Narcan is a very powerful life-saving medication that can reverse an opioid overdose. It does not reverse a stimulant overdose.
The deputy chief for Ben EMS says meth overdoses can be difficult to track.
When we go on a call, we report what we've seen and what drugs we've administered, the medical care we've provided. But the overdoses, especially things besides opioid overdoses, are very difficult.
The drug is often mixed with other substances, which complicates identification. The effects of meth are also not as immediate.
People don't die right off the bat, it seems like. It seems like it's prolonged use is where you start to see people that have those long-term effects and then maybe go into cardiac arrest.
Deschutes County Health says if you have Narcan on hand, use it, even if you don't know what substance has caused the overdose.
If someone is overdosing on a stimulant like methamphetamine, a Narcan actually may be able to help them because they were unaware that there was fentanyl or another opioid in their drug.
To address the rise in overdoses, some lawmakers are looking at making changes to Measure 110. If passed, the reforms would essentially recriminalize drug use and possession in Oregon.
We've talked quite a bit about Measure 110 here on this news program. Is it likely to pass there in the state legislature?
Well, when we look at the reforms, what we're seeing is Measure 110 has made it out of committee, and now the next steps are it's going to the House and Senate. So it still has a long way to go, but the changes do have bipartisan support.
All right, Jillian, thank you very much.